Hello everybody, my name is Austin Buller. I'm going to present to you my research dissemination project that is focused around pressure ulcer prevention strategies and charting of those strategies by nurses. I'm going to present using an S-bar format, so we'll start with the situation. The topic that I am using was based off a meeting I had with my unit manager related to practice issues. Whenever I talked to her, she was working with other managers to try and address the lack of charting related to strategies that we use to prevent skin impairment and pressure ulcers. This issue was realized after risk management had run audits trying to determine the cause of rising rate of skin injuries. The first impression that I had after leaving the meeting with my unit manager was they were working on creating new guidelines or having stricter expectations with charting. So I used that to develop my PICO question and guide my research. So here you can see my PICO question. If unit nurses are given stricter requirements towards implementing and the subsequent charting of pressure ulcer prevention techniques for patients that are deemed a higher risk of negative skin outcomes, will the patients show better skin outcomes on each unit after 6 months? Moving on to the background, this is just a quick review of some pressure ulcer risk factors, assessments, and prevention strategies, focusing more specifically on the prevention strategies, since that is the main concern. We have preventing friction and shear. We use slide boards and slide sheets, reduce moisture, especially in incontinent patients, frequent skin checks, encourage nutrition, positioning and repositioning, and pressure relief such as like specialty beds and mattresses or foam pads. Moving on to research I gathered, a study published in 2018 on a 30-bed adult medical surgical unit outlined an attempt at improving staff charting methods. Education was performed to all the employees, and then staff audits were performed on charting monthly during the study period. What they found was that access to patients' health information improved significantly, and although the staff was reluctant to the change, they did become familiar with the guidelines and established it well into their routine. Another study I looked at that was published in 2013 showed how when nurses are using electronic health record ineffectively, it can hinder patient care. The results showed that charting between nurses on the same pressure ulcer was not consistent with each other. Multiple areas of the EHR were being used to chart the information, and they didn't cross over with each other. Staff did not always fill out all the details for the pressure ulcers, and night shift often had less documentation. So these results helped to validate the need for a clear instruction to staff regarding the expectations of charting. The last case study involved a quality improvement project that was performed on a 30-bed acute rehab med-surg unit. They made a number of changes, including skin rounds on patients twice a week, accountability for any nurses that were not completing skin assessments, sharing of data monthly. All staff was included, including PCTs and physical therapy, and positive reinforcement was stressed to all the employees. These guidelines were in place starting August 2007 and were reviewed until September 2010. During that time, skin assessments on all patients rose to 100% compliance, and by December 2008, there was a 0% incidence of hospital-acquired pressure ulcers. My recommendation would be a quality improvement study. Pilot projects are a great way to help understand how the proposed changes can be expected to influence on a larger scale. Reporting this plan to my unit manager would be a great first step, and I can get approval or suggestions to change the plan. Following that, I can get involvement with education staff and risk management, as well as a final meeting with the chief nursing officer to get approval to move forward with actually conducting a quality improvement study. I would begin with educating the staff over about a month's time. Things like risk factors, interventions and treatments we use, and where everything should be charted. Then the expectations that the plan will follow throughout the course of the study. Here's the entire plan that I have laid out. There should be mandatory charting fields that are addressed for all patients, and then furthermore on patients that show risk or show an actual problem like a pressure ulcer or skin injury. Counseling should be provided to all nurses that are missing assessments or not charting complete details, which would require some regular audits. Staff should be aware when, why, and how to consult the wound team. They're able to provide great recommendations to monitoring and treatment of skin injuries. PCTs, physical therapy, any support staff should be encouraged to report any skin issues they see in case it's been missed by the nurse. There's involvement of skincare ambassadors, which is most like a volunteer type position among the staff nurses, someone that can act as a support to their peers peers, help perform good skin assessments, and recommend appropriate interventions. And then stress positive reinforcement to all the staff for doing a good job and improving their documentation. Now looking at the timeline, I'd expect about 1 month to complete education, so that way all staff has a chance to be educated, followed by monthly evaluations so we can see progress early and if necessary make some changes. After about 6 months we can evaluate the entire project, looking at pressure ulcer rates and the consistency of the charting. And although we hope to see no pressure ulcers on the patients, what we would prefer to see is present on admission rather than hospital acquired, which means we did not fully attend to the patient's care. With positive results, we can hopefully work to expand the new guidelines to more units throughout the hospital and encourage better practices among the staff. Thank you very much for your time. I hope you enjoyed my presentation. If you have any questions, please feel free to reach out to me.